Hello, and welcome back to our Women's Health Series, episode number 7. And we're going to be talking about what to expect when starting hormones and the transition and what to expect from us, the pharmacists. So, Janet, go ahead.
So, to make your life easier, I would find a primary who actually specializes in hormones, and that would not be usually your local OB or your primary doctor because they're going to put you on FDA approved products that may not be as beneficial. So, we recommend people that have been trained in hormone therapy and understand how to prescribe them. So that to me is like the first step, especially if somebody comes in the door and they're looking for somebody. We send them to people that we know that have had the training and understand what we're talking about as far as bioidenticals or natural, or whether it's appropriate with synthetic or whatever needs you might have. And the reason I say that is because I've counseled more women than not that have came from their OB or from their primary, and the first step that they're offered is an antidepressant.
Yeah, right. Believe it
I
or
have a
not.
huge issues with doctors and nurse practitioners and PAs prescribing antidepressants for a natural process that we have in our life where we actually just need to have a balance. We need a balance of hormones. So I think the number one step going through is choosing wisely who your prescriber is so you have a good relationship, because more times than not people are like, well, I'll go to my primary, they're open to this and they'll help me, and really they get shut down, or they're told things that are not really always beneficial, like you don't need hormones, you need an antidepressant or an antipsychotic. Or the best one out there that I absolutely love is, let's put you on a seizure med called gabapentin. Neurontin
For
was
your hot flashes.
brought out and it never worked for helping people with seizures. So let's just give it to everybody for everything. And
Besides that, because it didn't work for seizures.
right. So how did we get to this place? It's kind of crazy. So step out of that box, ladies. You need to find, or men for that matter, you need to find people who actually know how to prescribe them. So that's step one.
And that's typically what we recommend. And we will get people that will say, well, I've been going to Dr. So-and-so for many years now. Can we use him? And we're like, yeah, you can, but I'll tell you, you're going to get the runaround. Sure enough,
Right.
A few weeks or months later, after they've tried and tried and tried, and even, we tried to work with that doctor,
Yeah.
which we just don't typically do anymore. When a patient comes to us and says, well, can you work with my doctor, Dr. So-and-so? We're just like, no, it's a waste of our time, his time, and your time. This is where you need to go. We give you a referral, and then you don't have to, beg, plead, and rob and steal to try to get somebody to prescribe hormones. You actually get somebody that knows what they're doing,
Right.
so you'll get the best care.
So step two is, if you haven't already made a connection with the pharmacy that sells or makes or compounds bioidentical hormones, you need to really find one. Um, I've heard so many stories of people that go to their local chain store, and most of those pharmacists are not educated on the level to help you. In fact, sometimes they tell you the exact opposite of what you need to do. So you need to really establish care with a compounding pharmacy that has people that specialize in the hormone replacement, that knows how to deliver the correct product to you, as well as being able to educate you and help you and counsel you in the appropriate manner. So that's important. So
I'm going
don't
to
just
go
go
one
in the
step
dark.
further on that. Pick a pharmacy that not only specializes in hormones and compounding hormones, but also and specializes in the education of you,
Right.
on educating you about them, but also one that does not bill insurance.
Mhm.
Why do I say that?
Mm.
Well, because I can tell you that if a pharmacy is billing insurance, even if your hormones aren't covered on their insurance, if they are billing insurance, they are spending a majority of their time fighting with insurance companies. Their major goal is not the patient in front of them and how can they help that person in front of them.
They can't.
They can't, because the insurance company is telling them how to do business. So do not go to a pharmacy that bills insurance. I'm going to back up on that too with the doctor that you choose. If you want to get the best care for the doctor that you choose, go to a doctor that doesn't bill insurance. Doctors that bill insurance, they work for the insurance company. They don't work for you, the consumer.
So a lot of clients will say, well, how can you afford this? Well, how can you not afford this? I mean, seriously, how can you not afford to be healthy? If you don't put the investment in now as you are living a life that you can make changes, and that means if you're still alive, right? You have to make an investment. It is an investment. Your health is worthy of your time, efforts, money, and the investment of it. So make it a priority for yourself. So you are responsible for yourself. In the insurance model, that's not the case. They try to make the government responsible for you, or the insurance, or the doctor, but you're not. You're just being like checked off the box. It's standard of care is really not quality of care. So you have to be mindful of the fact that yes, you might have some out of pocket. Well, oh my God, I can't afford that. Well, that's not true.
Right. Can you afford this? Do you have this little device? Can you afford that? Then you can afford hormones. Remember, insurance is what makes things expensive.
Right.
When you pay out of pocket for services, Janet and I do not have a drug in our pharmacy that we sell for thousands of dollars. No. In fact, very rarely do we have a drug, a transaction that we sell somebody something for over $200. And that's a 3-month supply. Now, right. Mind you, the average drug cost, at a typical pharmacy is well over $500 a month for a 30-day, $500 for a 30-day supply. So why? Because our patients pay cash. We don't bill insurance. So our prices are a lot better based on that, because we know that most patients aren't going to pay $2,000 a month for a drug, but insurance companies or government entities would. So we want to make sure our patients get the best care at the best service and the best quality at the best price. And that's one of the reasons we don't bill insurance.
But it also takes time in the proper fashion, I believe, because first of all, if you're going to a provider or healthcare professional who's not the answering to the insurance company, you are the consumer then, right? It puts you in the driver's seat, and usually they are willing to spend time with you and actually solve the root cause or the problem or other things that might be going on. And we have partnered for nearly 3 decades with people that are able to do that.
Right.
They don't spend their time spinning their wheels trying to be paid by a company. They are directly in front of you. You are the
for you.
Right. You are the consumer. That's who's in charge, and they work together with you. So that's super important. And the reason that also is important is because then they're not as willing to say, well, you need an antidepressant, or you need this, or they're giving you other drugs to mask the symptoms of what's really happening. So that's really important. Who you choose as a provider and who you choose as a pharmacy is super important.
Because you may not know this, but that's why we're doing this series. But insurance companies dictate what doctors prescribe.
Oh, for sure.
They tell them what to prescribe for you, not what's best. They tell you what to prescribe, and that's how they get reimbursed. So that's a whole other subject. Let's move on from that, and we'll talk more about the details of what to expect during when you start hormones. So after you go to your initial appointment, they'll run some labs. Usually they'll run the basic labs like your cholesterol and your sodium and, all those things. I can't remember the fancy names for them. It depends on the lab. CDC, CMP, your iron levels, all that kind of stuff. Just your basic stuff. Along with your hormones, they'll get estradiol level, progesterone level, testosterone level, including free testosterone, TSH for thyroid, including free T3 and free T4, and DHEA level. Those are the ones that are important for hormones. Don't forget about vitamin D. Vitamin D is the most important. It is a supplement you can ever take, and it is a hormone in itself. So, and then they'll probably start you on therapy, because labs are a tool to go along with symptoms and history, but they'll probably start you on therapy, and then and let's just talk about some of the pricings of that. So you would maybe be shocked. You will be shocked probably, but when paying out of pocket for labs, the providers that we work with, they'll get patients, they'll say, well, I want to bill my insurance for these labs because I have good insurance. Well, let me tell you, there's no such thing as good health insurance. There's not. For routine medical care, you should be paying out of pocket. So they'll say, okay, that's fine. If you pay for these labs, I'm using an example, and this can be a pretty close example. If you pay for these labs cash, it's like $100. If you pay out of pocket, or if you want me to bill the insurance, I don't know what if you want me to send them your insurance, I don't know what your insurance is going to pay, and you might end up paying more. Many times those labs are $1,000, and the patients end up paying $200+ out of pocket anyway.
You might as well pay up
you
front.
might as well pay up front, and then you don't have any surprises because you know what it is up front. You already know what the price is. Same thing with seeing the provider. You think that it's expensive to see a doctor. It's expensive to see a doctor when they bill insurance. Right. It's very affordable to see a doctor, $200-300 for a visit. That's very affordable. Remember, mechanics that don't go to school for 8 years charge $200 an hour for diagnosis fees. So that's a good example. And most people don't have a problem taking their car to a mechanic and getting charged that.
But you're not getting them for 5 or 10 minutes.
No, you'll get these people for an hour,
right?
At the initial visit, usually,
right.
Sometimes more. Then they'll start you on some I call them medications, but hormones, bioidentical hormones. Let's just go over some pricing. Estrogen, for instance, for a 3-month supply, you're talking about, let's just say $80. Progesterone for a 3-month supply, $80 to $90. DHEA for a 3-month supply, $40 probably.
Depends on
depending on the strength, right. But $40
or less. 30, I think, for women, and maybe 50 for men.
Testosterone for a 3-month supply, $80. And then thyroid for 3-month supply, $90. So what do we got?
It depends, of course, on dosing, but right. When you're starting out. So if you think about this with what we spend in our culture, that's about $1 a day. For how long?
A 3-month supply. Well, for all of those, it's more than that. For all of those, it's probably about $300 for you can expect probably $300 for a 3-month supply. Think about that. That's $3 a day. That's right, less than you spend. That's less than that's half of what you'd buy on pay for a Starbucks a day. That's less than a cell phone bill. So very, very affordable. Your health is worth it. How much do you want to invest in your health? I mean, that's really what you have to ask yourself. Pay now or pay later.
And the one thing, to step back into this realm is when you see providers in this realm, most of them, not all of them, but most of them are also on a health journey themselves. And that is super important to me. I do not choose to go to someone who doesn't look healthy. I don't go to a dentist that doesn't have nice teeth, right? My dentist has white teeth that are straight, right?
Of course.
Good job.
So why would you go to a fat, metabolically unhealthy doctor? I'm just saying it. I'm saying it. I wouldn't for my general health. If I broke my arm and the orthopedic surgeon was fat, okay, then fix my arm. If I had cancer and the oncologist, that's a whole other story. But if you were going to a doctor for your general health, no. Go to somebody that is healthy themselves. And I'm going to go on and say this too. And their spouse is healthy.
So here's why we say that is because, again, we know that hormones are part of the picture, right? They are part of the puzzle. But if you do not get good counseling on sleep, diet, and exercise, we've missed the point.
That's right.
We've missed it. It's not just one little thing. If you look at like this as our overall health in the United States right now, since I graduated from college, it has not changed. In fact, it has gotten worse. Healthcare in the United States is still heart disease, obesity, diabetes, and cancer are still the top killers in our country. We haven't changed that in what we are doing in this other model. So that should tell you about the insurance model and the model that is being out there. And like Shawn mentioned, of course, there are times where we do need to access care from a traditional, we call it traditional, allopathic doctor. And I'm not saying that isn't appropriate, But in this case, I think if you are investing your time, efforts, and money and investing in yourself, pay attention to who's sitting in front of you. Pay attention to their health. And many times I've asked this question when somebody has said to me, well, so and so told me this. And I'm like, I haven't met your provider, but tell me about them. Are they healthy? Do they have ideal weight? Are they exercising?
just
Do
a great
they
question.
look like they have invested in themselves? Because if you're taking advice from people that don't care about themselves, how do they care about your health? And I'm not trying to be mean, or
Just
I'm
facts.
just saying that most likely, if you find somebody who's invested in themselves, they are going to give you better advice and better care overall.
You wouldn't go to a personal trainer that was overweight, would you? At a gym? Of course you wouldn't.
No, you
So
wouldn't pay
what?
that.
No.
No.
So why would you do that with a doctor? So what is our role as the pharmacist? So we talk to our patients when they first get the medications, and we talked to them in the previous episode. We talked about what can be some of the side effects of hormones if dosing is not correct. So go back to that as a reference. But we talked to them about dosing. We talked to them what to expect. Some symptoms will get better than others. A few of the symptoms that will get better faster are hot flashes.
Mm-hmm.
I don't love it necessarily when a woman calls and her chief complaint, or she's starting hormones and her chief complaint is hot flashes. I don't necessarily love that, but I will tell you this, that's one of the easiest things to fix. And I will reassure her that maybe within one night, definitely within a week, your hot flashes will probably be gone, mostly if dosed appropriately. But you got to make sure that it's dosed appropriately. That's why it's important to go to the right person to prescribe appropriately.
And they might need to adjust.
Right. And they might need to adjust. And if your dose gets too high with estrogen, because we would dose estrogen for hot flashes mostly, depending on where you're at in your life cycle. If it gets too high, then you would have breast tenderness. So we'll tell them that. And another one is vaginal dryness. If you're using a topical estrogen vaginally, if you use that, you get dosed the right amount, your vaginal dryness will go away within a week. So, that's I like to reassure them with those things. Those things are pretty easy to fix. Some of the harder things are, libido. Libido, it's not hard necessarily. It just takes longer. Weight gain, things like that, just takes longer, and there's more to the process. Janet?
Right. And here's also a reality check that I tell people. This didn't happen to you overnight.
Unless you had a hysterectomy.
Exactly.
Darn it.
So when you are presenting yourself with symptoms, realize that time might be involved. So that also means that we need to give the hormones a chance to be replaced. And Shawn was talking about hot flashes and estrogen. One of the things that we have to work with estrogen is you can't give you the whole bucket all at once, because many times things like nausea or anxiousness can happen if it's not balanced with progesterone. So we can't fill the bucket up immediately. But what's really important is that we move in the right direction, and realizing the process is not as indefinite in time. Like Shawn says, hot flashes should be fairly quickly resolved and helped. If they're not, adjustments need to be made. But realize the fact that these changes happen to you subtly, unless, like Shawn said, it was a hysterectomy or an oophorectomy, right. So there is sometimes where I have to say, give your body the chance to respond to these hormones. And that might mean, for example, when I talk about women with progesterone and they've had sleep deprivation, it does take some time. But when you start sleeping, you're going to feel differently. Libido is another thing, like Shawn jumped in and talked about with testosterone. Libido might take some time. Progesterone is going to help with that to some degree, because if you're sleeping better, you're repairing better. But when your testosterone level gets to an optimal level, then those things will improve. So it depends on what the symptom is as to how quickly that can be resolved.
And some things some things we're talking about symptoms that are more short term. Mm-hmm. There are long-term benefits of hormones, right, like your bone health, which is going to take, over a year for your bones to get stronger, probably. There's some certain tests that you can show Not for the purpose of this discussion, but that will show how your bones are getting stronger sooner. But typically, you're not going to be able to see those benefits for a year. Some other things, increase lean body mass, those can take longer too. Your skin health, your vaginal health, things like that can take longer, but you'll see those benefits over time. So here's another question that we often get: when is it appropriate to start bioidentical hormones, Janet?
So unlike what is being taught out to our standard of care Western allopathic doctors and practitioners, anytime that you're still alive, I mean, in my opinion, you're never too old, it's never too late. Where they go wrong in this is they say, well, if you haven't received hormone replacement in 5 years after a hysterectomy or after menopause, then you don't qualify as in need. Well, I still have bones and a brain and muscles and tissues. So
that's just the dumbest thing I've ever heard.
But those same people will give you a statin for cholesterol. They will give you
Fosamax
for your bone.
They'll give you
an antidepressant,
lisinopril for your blood pressure.
And
the list goes on.
So here's the thing. The thing is with hormones is that as long as you are walking and breathing as an organism of a human being, you still have organs. You still have a brain. You still have a heart. You still have muscle, and you still have bone. And you also have mental and emotional health. Or even, let's throw in the immune system. We still have immune systems. Why aren't we repairing that? If you're not sleeping, if a woman is not sleeping at night, how are you repairing? How are you recovering and being healthy? Excuse me, that's like 101 in health. So you're never too late. And I know you might have to step out of your box, stop going to that person in front of you that's telling you no. But as long as you're still here and walking and breathing, you're a candidate for help.
That's right.
Hormones are for you if you need them.
We have 80-year-old women that start on hormones for many reasons, for brain health, because they're having vaginal issues or they're having urinary tract infections. And think about that. If they're starting on them then the old question about how long should they stay on them? Well, if they don't want to have urinary tract problems anymore, they'll stay on it for the rest of their life. They're not going to magically start producing their own hormones again. So that's what I tell people. So it's never too late. And, the same goes for men. That's a topic of another discussion we're going to have in the future. What does it look like 8 weeks later? Usually 8 weeks later, they recheck your labs.
Or symptoms,
they still usually recheck your labs, depending on the provider. But yes, symptoms and history are very important. How are you doing? Do you have any side effects? Oily skin, acne? Are you doing any better? And anytime those symptoms get better, it's a win. So that's the first thing I'll say. Well, is the vaginal dryness better? Yes. Okay. So are the hot flashes better? Yes. Are you sleeping better? Yes. Okay. Well, I haven't lost weight yet. Okay. That takes longer. Okay. And there's some other details we got to get along the way, but it's a win when those symptoms get better. So don't expect all of them to get better all at the same time.
No. And Shawn did mention about your bone health. One thing that we can look at that we didn't talk about this is there is a test that you can use.
I said we weren't going to talk about that.
We can use for your urine to see how much bone is actually being excreted. And that should change very quickly if we have enough estrogen.
The NTX
test. Yeah. And that is a very quick, sample to see, are you still excreting bone? Right. And so that's a very fast thing to do. It's very easy to do. And really, it's not complex. So we can see if we've changed that picture as far as in a short term. Now, I do think it takes longer for overall, but at one point in time, we can say you were spilling this much bone. Now we're not. So that's a little bit faster than some of the other tests.
Testosterone's amazing for bone health. So what could you expect? So a lot of times 8 weeks later, the dosages will change possibly. And then what do you expect after that, Janet?
So if we're going in the right direction and you're feeling better, unless something comes up, I just tell women wait 6 months to a year. Um, if you're in perimenopause, that can be a little
Yeah.
more trickier, because your levels can be all over the place. So that might be not always looking at labs, but also addressing your symptom changing. So those dynamics and communications between your provider might be a little different. And that could play into them changing maybe your progesterone levels or even testosterone levels, depending on how you're feeling. So that communication might have to go up and down. And that's not uncommon, because what's really happening is that your ovaries are spilling and making hormones and then they're not. So it's not something we can say, well, yep, this is it, this is the dose and that's where you need to stay, because your body is very erratic at this point. And so you need to adjust as time goes. The other place that I feel that we really haven't focused on a lot is if you have a thyroid issue and you usually at what, 14 weeks, 8 weeks to 14 weeks, they probably want to look at
Oh,
those
you're at that
labs
8 weeks.
and what improvements are either happening or not. Because if you have a thyroid problem, we want to address that and get you to the right levels. And that sometimes takes a little bit longer because thyroid needs to build up in the blood um, to have its full effect.
Yeah. And the last thing as we wind this episode up, I want to go over is we get this quite often actually is people had a bad experience with bioidentical hormones.
Mhm.
And I will tell you why. And we still work with some of these providers
Yeah.
that underprescribe. They don't prescribe a high enough dose. They don't get aggressive enough when it comes to dosing, and they're super cautious when it comes to dosing, whether it be estrogen, whether it be testosterone. And we're talking about women now. Um, and I will tell them it's like, well, you weren't being dosed appropriately, and so it's important to go to a provider that knows about optimal dosing and not just reading lab levels as black and white, because realize that normal lab levels are not necessarily optimal.
Right.
Think about a woman's hormones being when they look at the level of a woman's hormones post menopause, when she's post menopause, there'll literally be lab numbers that say your number should be 0 to X. 0 is normal. Well, yeah, but what was it when I was 35 when I felt
Right.
good?
Yeah.
That's what you really want to be. So you want to know, you want to go to a person that knows about that and knows dosing optimally, and basically knows that labs are a tool to go along with symptoms and your history.
Right. So one of my biggest pet peeves as a pharmacist is to see a dose that's changed by 0.0125. And the reason I tell you this is because if somebody's just kind of moving the number barely, to me,
Yeah,
what we
right.
aren't changing much.
It's like
Now, that might be true with thyroid. I get that. But if we're talking to estrogen, it's kind of a funny thing.
with
Um,
milligram dosing.
right.
Yeah.
So, if they aren't adjusting appropriately, that can be a problem. And that's where a pharmacist can help you, especially one that has been in the industry and helps with hormones. You can kind of sift through that and say, well, the symptom probably relates more to dosing in a way that needs to be adjusted appropriately. So,
And the beauty of us is we've been doing this for almost 30 years. So we work with providers on all spectrums. So from being super conservative when it comes to dosing, and from being super um, aggressive when it comes to dosing. So we know, we know who does what and how to steer people the right direction so they get optimal levels and feel optimal. That's what's the most important, is feeling optimal without side effects. So as we wrap this up, Janet, what do you want to say about a pharmacist's role when it comes to dosing hormones?
So my role is to help people, first of all, I think, find the right fit if they need help doing that, but also to help them walk through some, how they're feeling, if they're feeling appropriately or not after they've been on hormones. So if things come up, whether it's appropriate to go in or call their doctor, so counseling is super important. I feel also, to share with people resources if they need them. But we just really are a tool. We're a tool for education to help them navigate their health. And in this industry, I think sometimes it's very hard because you get on Dr. Google and it's like going down a rabbit hole. So,
Yeah, but we want you to do your own research. Don't
right.
don't don't
We're not
you know
saying not to,
no.
but I'm saying that, how to point people in a direction that might be helpful for them to find the answers.
Our goal, as always, is to educate and empower individuals to take charge of their own health. We've been doing that at Moses Lake Professional Pharmacy for over 26 years now, and we talk more than just hormones. I mean, yes, I'm not going to lie, that's where we make our majority of our income. Um, but we also tell people that, look, hormones are a piece of the puzzle. And you have to still do the diet, the sleep, the exercise, and that's okay, because Jan and I have both been on those journeys ourselves before, and we can help you along that journey. So that's our goal, is to help you transition into menopause optimally. So thank you for watching. This is episode 7 of our women's health series, and we have about 3 more episodes. So stay tuned for those. Thank you for watching.